Welcome back to Jersey Matters. I'm Larry Menti. The high maternal mortality rate in New Jersey has long been a public health concern. But as Jersey Matters' Phil Andrews tells us, it is a problem exacerbated by the challenge of getting accurate information.
New Jersey Governor Phil Murphy might get all the attention, but as we know, behind every good man, there is a good, or in this case, great woman. Tally Murphy has her own brand of philanthropy, and one of the causes she is compassionate about is New Jersey's maternity mortality rate, which is among the worst in the country, especially for the Garden State's minority population.
The more I understood that it was actually racial disparity and it was systemic racism, I think that I became more and more determined to find a solution.
Women are dying in the United States at alarmingly high levels. There are many countries, such as Russia, that have far fewer women dying than the United States. And then, of course, as you know, when we go by a state-by-state comparison, some of our states compare to third world countries for their rate of maternal deaths.
Kay Van Way is a patient equity advocate with over 30 years' experience fighting against countless injustices and racial discriminations in the healthcare system. Explain what it is we're actually talking about, what the problem is. Explain that part of it, and then we can get to the technical side of it in a second.
Maternal mortality basically means women dying during or immediately after childbirth. Many of the causes of women dying during or shortly after childbirth are completely preventable. Of course, there are some that are not, and some just tragic cases, but there are known deaths that are preventable. One example of that might be a postpartum hemorrhage. Most postpartum hemorrhages are completely preventable.
Why is it that the numbers are so different for minorities versus their white counterparts? Why is that the issue?
The reason more women of color are dying as a result of maternal mortality is complex in one sense and simple in another sense. One of the simple reasons is access to health care. Some women who are poorer or lack health insurance are not going to have good access to health care. Another reason is that for certain racial minorities, and the hospitals that serve those populations, they, across the board, fare worse, score lower on the care that they deliver.
Phil has been given a mandate in the state of New Jersey to help as many people as possible, and we've always worked as a team. And if I can help Phil and Sheila help as many people as possible, then I'm all in. The color of your skin should not impact the quality of the care you get or your chances of surviving maternity.
By the way, this past January, First Lady Murphy launched the Nurture New Jersey, her statewide awareness campaign that is committed to reducing infant and maternal mortality and morbidity. For Jersey Matters, I'm Phil Andrews.
Thank you, Phil. When we come right back, my commentary on court packing.